Happy morning, dear students. Today's topic is small for gestational age, SGM. What is the definition of small for gestational age? Is babies with a birth weight of less than 10th percentile for their gestational age. They are also termed as a small for gestational age or small for dates. Both are same. This is about the definition of small for gestational age. And next, causes. Here the what are the causes of small for gestational age? The first one is maternal causes, that is short structure mother, primary or grand multipara mothers. Okay, whether the primary or first pregnancy or multiple pregnancies is there. And next one is teenage pregnancy. Okay, mother who that girl is having pregnancy in the teen period, that is from 13 to 19 years. Those are called as teenage pregnant. And next one is low pre-pregnant weight. Some women's, some mothers, their weight is like their pre-pregnant. Whenever they are having pregnancy, also their birth weight, their weight is pre-pregnant. And next one is maternal illnesses like anemia, heart diseases, malaria, etc. Next one is complications of pregnancy like pregnancy induced hypertension. During pregnancy, mother is having severe hypertension, that is 150 by 90, above the 90 is blood pressure is there. So one of the complication of for this small for gestational age, that also is caused, that is PIH. And next one is mother is having habit of smoking, alcoholism or drug abuse by mother, that also one of the causes. And next one is poor weight gain during the pregnancy and previous similar babies. Okay, previous history also mother is having small for gestational age, that also one of the cause. These are the maternal causes. And next one is the placental causes. What are the placental causes? Means here the disorder of placental implantation. And what is placental disorder of placental implantation? Means normally the placenta is situated in the upper uterine segment, but the placenta is situated in the lower uterine segment. That also one of the cause for the small for gestational age. And next one is abruptio placenta. And placenta previa also is there. And then single umbilical artery. Here the one of the cause for the congenital malformations, that also a single umbilical artery is there. Okay, and next one is structural and functional abnormalities of the placenta and umbilical cord. Here the structural and functional abnormalities of placenta means here the placenta having two surfaces, maternal surface and fetal surface, and it is having cotyledons, and some structural problems also is there by cornea placental also, battledore placenta also. These are the some problems is related with the small for gestational age. These are the placental causes. Sometimes the cotyledons also is missing. Okay, that also one of the placental cause for the small for gestational age. And next one is the fetal factors. The fetal factors are firstborn babies are generally smaller. Okay, that is common because the uterus, the growing uterus is very rigid, and pelvic cavity also is very rigid. When mother is having gravida, to that time automatically next baby will gain weight normally, but first baby is generally similar, smaller it is there. And next one is twins or multiple pregnancy and intrauterine infections and genetic or chromosomal abnormalities. Some intrauterine infections like torch and some infections, pelvic inflammatory diseases, rubella, so many infections is there related for the small for gestational age. Genetic or chromosomal abnormalities, for example chromosomal abnormalities related with the muscular dystrophy conditions, DMD, Downey muscular dystrophy conditions, and Down syndrome. So many causes is there related with the fetal. Okay, and next one is environmental factors. The environmental factors are food, socio-economic status, nutritional habits, cultural practices. These are the environmental factors related for the causes of small for gestational age. And next, types. What are the types for the small for gestational age or small for dates are found here? Three types is there. Small for gestation or small for dates, both are same only. Okay, first one is types is malnourished small for dates infants is there. First one is these babies appear long, thin and alert. They look marasmic, poor subcutaneous fat and poor muscular mass also is there. Same, but babies look very long, but everything is look like marasmic. Marasmic means muscle wasting. There is no subcutaneous fat, and then muscles also is not there for this babies. Easily we will identify, okay, this baby is very small for dates or small for gestational. Their length of the baby is good, but the subcutaneous fat and muscle tone is not well developed. Baby look like an marasmic. Marasmic means muscle wasting. And they have excessive skin folds on the buttocks, thigh. In marasmic conditions, automatically we will identify. Means the folding of the skin mostly we will see in the buttocks and then thighs. So many foldings is there like a monkey. Okay, it is there. And the difference in the head circumference and chest circumference is more than 3 centimeters is there. Actually how much the difference it is there, 1 centimeters, 1 to 2 centimeters it is there, but here the more than 3 centimeters difference is there in between the head circumference and then chest circumference. Okay, this is about the malnourished small for infants. And then internal organs such as liver, thymus, lungs are shrunken, but pulmonary alveoli are mature as per the gestational age. Here the but alveoli is well and good according to the gestational age. It is matured normally, but the liver, thymus gland and then lungs are shrunken, but the pulmonary alveoli are measuring as per the gestational age. This is about the malnourished small for dates infant children. Okay, how they are having types. And next one is in these infants the growth arrest probably occurred in the later part of the pregnancy due to reduction in the cell size but not the cell numbers. The reduction is there in the cell size, but for example cells is well developed it is, but the size of the cells is very less. It may related with their parents physics for example their height and weight also it is related with that. Okay, so but the cells is good, but the cell size is not good. Okay, and then prognosis of the physical growth is better compared to the LBW or preterm baby. And this small for gestational or small for date babies prognosis is better or somewhat good. Next one is hypoplastic small for dates babies. In case of intrauterine infections, genetic defects, chromosomal aberrations, growth retardation occur in the early part of the pregnancy. The number of body cells is reduced. These babies are small, including the head size. Prognosis is poor, permanent mental and then physical growth retardation is there. Mainly we will identify hypoplastic small for dates. Here the child is having because of some intrauterine infections and genetic defects. The chromosomal abnormalities also it is related with the mental and physical retardation. For example, this mental retardation, the head size are is compared to another term baby, the head size is very small. Okay, that is called as hyperplastic small for small for dates. And next third one is mixed groups. There is a reduction in the cell number and the cell size because of adverse factors operate during the both early and then mid pregnancy. These are the mixed groups. There is a reduction in the cell number. Sometimes cell number reduction also is there, but here the size also is having some adverse factors operating during the both the early and then mid pregnancy. It is there. These are the causes for the small for types for the small for gestational age. or small for dates. Next, common problems of small for dates babies. What are the problems is related with the small for dates or small for gestational age babies is birth asphyxia, small for date infant suffering from the prenatal asphyxia due to the maternal factors and placental insufficiency. Okay, and next one is next common problem is some of them passes meconium in the utero due to the distress are liable to develop meconium aspiration syndrome because during internal period intrauterine only baby may pass the meconium. At the same time baby may swallow the meconium. It may distress because of meconium aspiration. Baby is taking the this meconium. What happened, the lungs is infected, so meconium aspiration also is there. Because of why meconium aspiration is there, passage of the meconium, everything, why it is occur, because of some asphyxia. The blood circulation is not attained properly to the baby. That time the vitals is impaired. The blood circulation to brain is decreased, so automatically because of some compressions, because of some deformity of congenital malformations, everything, baby may passing the meconium during intrauterine life. Okay, and next one is fetal hypoxia and introspection death due to the placed dysfunctions. Here the fetal hypoxia mostly we have seen in the small for dates children. And next one is inappropriate thermoregulation. Here the baby is unable to maintain the thermoregulation. Mostly hypothermia we will identify in those conditions. And next one is pulmonary hemorrhage, polycythemia due to unknown causes. Here the polycythemia vera also we will identify, that is blood thickness. Okay, some clots also is present in the blood circulation. During the circulation mostly we will identify this polycythemia vera obstructions, that clot may identify in the brain cells also. Okay, these are the common problems we will identify. And more problems are increased risk of infections, poor growth potentials, metabolic changes. These infants developed hypoglycemia due to poor reserve of glycogen and fat. Okay, here the metabolic changes mostly which is the common is hypoglycemia. The blood sugar levels is very less in the children. Okay, next one is hypokalemia is frequent because of transistent hypoparathyroidism. Okay, because of that the child is suffering with the hypokalemia. Okay, these are the common problems for small for dates babies. And next one is management. Here how we will manage for this small for dates babies means, whenever a small for date fetus is suspected, carefully observation of mother is made due to whenever a small for dates fetus is suspected, careful observation for mother is made to determine low birth weight with the help of ultrasonography. The majority of fetal deaths occur after 36 weeks of gestation, so correct the diagnosis is essential. Here first of all you should identify the mothers who are having bad obstetrical history, who are having some environmental factors, placental factors and maternal factors. Those mothers should be identified early, and then we should prevent the complications of the small for dates. And mostly after 36 weeks only these problems will be arise, so we have to prevent. And next one is mother is advised for the adequate bed rest in the left lateral position. Okay, those risk mothers we should identify, and then you should provide proper rest for those mothers. And which position is preferable is, that is left lateral position is preferable for those mothers. And to correct malnutrition by balanced diet, that is 300 extra calories per day to be taken. Okay, how much it is needed per day extra? 300 calories is needed for each day. and avoid smoking and alcohol should be restricted. And next one is fetal growth and assessment of well-being of for his to be done by the NST. Here we should identify, and then well-being for the well-being of the babies we should follow for fetal growth and by NST. Okay, this is about the management. All of you clear what is small for gestational age? Here the 10th percentile of just weight is decreased. So here we should identify those mothers and then give proper rest, and then early identification and prevention of this small for gestational age or small for AIDS, which should easily preventable. Okay, this is about today's topic.